Questions 501 to 520. 501 blank, disease failure of neonate to pass stool meconium for 24 hours. The answer is Hirschsprung. 502. Apgar score done at blank at birth. The answer is 1 minute and 5 minutes. 503 most common cause of diarrhea in pediatric is blank. The answer is virus rotavirus. 504 meconium is blank. The answer is dark green stool in newborn. 505 less than 24 hours after postpartum calls a nurse in the mother/infant unit. She reports that she has very heavy bright red bleeding. Being discharged, a mother who is newly, what would be the best advice to give her? A. Don't worry about it, it is normal. B. Call your doctor and ask what to do. C. Lie down, massage lower abdomen. If it does not work, then come to the hospital immediately. D. Lie down for about an hour, then check your bleeding. If it is still as heavy, call me back. The answer is C. Lie down, massage lower abdomen. If it does not work, then come to the hospital immediately. 506 at 20 weeks pregnant, primary gravid woman visits the antenatal, has sickle cell anemia trait and worried this disease transmitted to her baby. Which of the following should be initial intervention? A. Plan for the fetal genetic screening. B. Educate mother that her disease is inactive. C. Discuss the chances of genetic disease in the fetus. D. Gather data about the other family members having the disease. The answer is D. Gather data about the other family members having the disease. 507 a pregnant woman of 15-week gestation age and RHVE has an abortion admitted in the ward. What should the nurse do for this woman? A. Administer room within 72 hours. B. Do not give room since it is not used with abortion. C. Do not give room since the pregnancy is more than 12. D. Make certain she received room on her first clinic visit. The answer is A. Administer room within 72 hours. 508 4 days old baby diagnosed with physiological jaundice. His father is distressed and wants to know why he have this condition. What should the nurse tell thee about the most prominent physiological jaundice? A. Immature hepatic function. B. Decreased milk intake. C. Rh incompatibility. D. Red blood cell enzyme defects. The answer is A. Immature hepatic function. 509 in determining the 1-minute Apgar score of a male infant, the nurse assesses a heart rate of 120 beats per minute and respiratory rate of 44 per minute. He has flaccid muscle tone with slight flexion and resistance to straightening. He has a loud cry with color, is a crocyanotic. What is the Apgar score for the infant? A. 7. B. 8. C. 9. D. 10. The answer is B. 8. 510 5 minutes postbirth, a neonate has a heart rate of 98, irregular breathing, actively moves all extremities, but has bluish hands and feet, as a weak and timid cry. Which is the correct Apgar assessment score? A. 9. B. 8. C. 7. D. 6. The answer is D. 6. 511 a nurse documented assessment on a newborn is listed, see table, points indicator less than 98 per minute heart rate, 28 per minute irregular respiratory rate, muscle tone, minimal flexion of the extremities, reflex irritability, grimace, body pink, extremities blue color. What is the total Apgar score? A. 0. B. 3. C. 5. The answer is C. 5. 512 toddler is admitted to the pediatric room with several episodes of diarrhea 3 days. The child is diagnosed with gastroenteritis. Which organism is responsible about the most diarrhea episodes in children? A. Rota. B. Bacillus magisterium. C. Shigella. D. Staphylococcus. The answer is A. Rota. 513. A child with a diagnosis of tetralogy of Fallot is scheduled to be discharged from the hospital. The nurse who is planning discharge education should instruct the caregivers that during a hypercyanotic spell, which position is most likely to benefit the child? A. Supine. B. Out prone. C. Side lying. D. Knee chest. The answer is D. Knee chest. 514. A 12-year-old boy was brought to the emergency respiratory arrest due to drowning. Cardiac resuscitation. What is the major complication that might happen if treated after drowning quickly? E. Sepsis. F. Alkalosis. G. Acidosis. H. Hypothermia. The answer is C. Acidosis. 515. Which of the following is the leading cause of injury for children who are more than 5 years old? A. Accidental suffocation. B. Motor vehicle. C. Congenital anomalies. D. Drowning. The answer is B. Motor vehicle. 516. A 1-year-old girl admitted to Pediatric medical unit significant weight loss, diminished mid-arm circumference diarrhea, and red hair. Which of the following type of malnutrition do the nurse suspect? A. Marasmus. B. Spitting up. C. Kwashiorkor. D. Rickets. The answer is C. Kwashiorkor. 517. 33-month-old infant is admitted to the emergency department, ED, with fractured arm. The mother indicated that while the child was crawling fell down the stairs and broke his arm. Which of the following observation would lead the nurse to suspect that this is a victim of abuse? A. Age inappropriate injury. B. Pattern and shape of the injury. C. A child is appearing malnourished. D. Improper explanation of the cause of injury. The answer is A. Age inappropriate injury. 518. 5-year-old child was brought to the emergency room with a fractured right forearm. He had several bruises on his body but showed no signs of pain while palpating them. He seemed scared and did not answer any questions asked. Why should the nurse discuss this case with the nurse manager? A. Continuity of care. B. Rule out child abuse. C. Psychological support. D. Fracture management. The answer is B. Rule out child abuse. 519. A 4-year-old child is seen in the emergency department with a spiral fracture of the left arm. The X-ray examination showed previously broken heel bones. What is your immediate action? A. Call social services to immediately arrange foster care for the child. B. Ask the child about the previous accidents and management. C. Report the child abuse to the local authorities. D. Try to establish rapport and trust with the child's family. The answer is C. Report the child abuse to the local authorities. 520. A 62-year-old woman admitted to the emergency department for the 4th time this year, each time the patient comes with severe injuries and bruises in the body. What is your responsibility as a nurse to prevent such incident to happen again? A. Reports the assault to the local police and write a report. B. Provides information about safe shelter and support. C. Instructs the women to move away from her home. D. Discharge the patient to a safe shelter. The answer is A. Reports the assault to the local police and write a report.